Morning and good afternoon and good evening. Thank you all wonderful people for joining us today on this Part Live forum, where we will be discussing the future of Malaria vaccine focusing on innovation, access, and impact. My name is John Bawa, and I lead the Malaria vaccine introduction and implementation at PATH, and I'm delighted to be moderating today's conversation. Before we start, I would like us to go over a few logistics. We want to really hear all of you because we know all of you are dedicated people who really have been committed to the malaria vaccine, and we want to see its progress into the future. So please share your questions and comments with us by submitting them in the Q&A box in the chat at any time throughout this section. And I'll be monitoring your questions, and we will be saving time at the end of the hour for an audience Q&A. And for a final note on logistics, we are recording this call, and it will be distributed to all of you, including those who are unable to attend. I see participants coming from all walks of life and all over the world. Thank you, government representatives, community organizations, NGOs, donors, and private sector partners, and others who are joining us. We really appreciate your time that you are spending with us. As an overview for our session today, I will introduce our panelists and then briefly frame the conversation before diving into facilitated Q&A with each of our panelists. We are honored to be joined today by an amazing group of health leaders who have been associated with the malaria vaccine for many, many years. We have today with us Dr. Scott Gordon, who is the head of malaria vaccine program at Gavi. Dr. Gordon previously was the lead for the malaria vaccine introduction at PATH. And as most of you might have become aware, he was instrumental with the role that he played in the malaria vaccine implementation programs that happened in Ghana, Kenya, and Malawi when working at PATH, and also transitioned and translated all that knowledge to be able to help set up the Gavi malaria program, which is supporting countries in the introduction and implementation as we move ahead. Secondly, we'll also be hearing from Professor Kwekupoku Asante, who's the director of the Kintampo Health Research Center. Professor Asante has been associated with the malaria vaccine for more than 25 years. He was instrumental in the early studies that were conducted on the RTSS and all the data and the generation of the information that have become available, which WHO has used to make recommendations that we use today. He also led part of the team that did the malaria vaccine implementation in terms of the evaluations based on which the current recommendations that have been made by WHO has been made. We also will be hearing from Dr. Eric Nebie, who is based in Burkina Faso and who leads the PATH Technical Assistance Project on the malaria vaccine. Dr. Nebie has been working with the Ministry of Health and partners in Burkina Faso and support other efforts that PATH is undertaking in other parts of Africa to be able to ensure that malaria vaccine indeed becomes available and accessible to all children in these locations. So these are the wonderful people that we'll be listening to today. Thank you all for being with us today, and we appreciate your time. Now, I'll frame our conversation today. Now, we all know that with the rollout of the first malaria vaccine now underway in several African countries, we have entered into a new phase of prevention. After the successful pilot in Ghana, Kenya, and Malawi, and having other new countries, now we have 17 more countries besides Ghana, Kenya, and Malawi that have taken up the malaria vaccine and counting. We have other countries that have gotten their proposals or introduction plans approved and are getting ready to join as quickly as possible. So how do we ensure that, one, we sustain what we started? Two, most countries did phased introduction. So even though we have a lot of countries where the vaccine is currently accessible or available in countries, there are a lot more children in these countries that needs to have access to the vaccine. So how do we ensure that the vaccine becomes available, scaled up in all these countries fully? And also, how do we ensure that continuously they are accessible? And we know that this is a 4-dose vaccine. So how do we also ensure that all children who are having access to the vaccine can take all their 4 doses? So today's webinar will explore the future of malaria vaccine, examining innovation, access, and impact. And our panelists we'll discuss the challenges and opportunities ahead, from vaccine development and implementation to ensuring equitable access and sustainable health outcomes. So let's start with our first question. And our first question would go to Dr. Scott Gordon of Gavi. Now, Gavi has supported broader introduction and more countries are coming on board. And with all these things underway across several African countries, what are some of the key challenges that Gavi is seeing in aligning the vaccine rollout with country readiness, particularly in the context of existing immunization pressures and supply constraints? And I want to add again that given all the limitations with the global funding landscape for public health and immunizations, what is the plan that Gavi has in order to be able to ensure that the vaccine is not only phased into expanded to all the children that need it, but also ensure it becomes sustainable going forward? Dr. Gordon.
Thanks, John. Well, before I jump into the challenges, I just want to echo a point that you made before, which is that we are seeing unprecedented demand for the malaria vaccines. As you noted, 17 countries have introduced the vaccine in the past 17 months. That brings us to a total of 20 countries that are currently implementing the vaccines. Now, if we look at the total burden of malaria in those countries, it accounts for more than 70% of the world's malaria burden. So while these countries have all introduced the vaccine subnationally, we feel that with the support of the vaccines, we are really on our way to making a significant impact on the burden of malaria, particularly in the most vulnerable children. Now, on to some of the challenges that we are seeing around rolling out the vaccine. The first is actually linked to the excitement about the vaccine, and it's the challenge of aligning the excitement and the drive to introduce the vaccine with the steps that are necessary to ensure that the programs themselves, the communities themselves, are ready to introduce the vaccines. As you noted, the vaccines have a unique schedule. They require at least 2 additional immunization touch points during the first year of life and an additional touch point during the second year of life. This means that the immunization programs themselves have to plan for and prepare for these new immunization touch points, including training their health workers to provide the vaccine at these additional times. There's also a great deal of work that needs to go in at the community level to prepare the communities and the parents to bring their children in for the vaccine at these additional touch points. And it's these preparations, they take time and effort, and that's where we as Gavi, together with our partners such as PATH, really need to ensure that countries take the time to plan and prepare for the vaccine. The second big challenge that I want to flag is similar and linked, but it's really about balancing the excitement about the vaccine with the realities that are entailed in providing a new vaccine. Given the excitement of the new vaccine, it's a new tool, it's an impactful tool. It's one that we as Gavi are very excited about and the countries are very excited about. But given all that excitement, we know that ministers, donors, and the international community expect to see high coverage with the vaccine and high impact right away. And whereas we know that countries are seeing the positive effects of the vaccine, it does take time and effort to increase the coverage of any new vaccine, particularly one with a unique schedule like the malaria vaccines. So it also takes time for country data systems to be able to capture the impact. Although malaria is prevalent in the communities and can be diagnosed relatively straightforward, it is challenging to measure in many settings. The tools, the indicators, they take time to capture the impact of the vaccines. So we need to be patient around looking for the impact of the vaccine as it's being rolled out in these countries, but we also need to maintain the activities and the enthusiasm that we have around encouraging the communities to utilize the vaccine and the healthcare system provided. The final challenge that I want to flag is one that you alluded to in your opening comment as well, and that's really around the adequate resources to support the rollout and the provision of the vaccines. We now have 2 vaccine suppliers, which means that there is sufficient supply to meet the potential demand in moderate and high transmission areas of Africa. However, what we do face is challenges around the financial resources that we need to be able to move forward. Gavi is currently undertaking our replenishment, which is the process through which we generate the funds for our next strategic cycle, which in the case of Gavi will be between 2026 and 2030. Unfortunately, this is coming at a time when we are seeing a major upheaval and disruption around the funding for global health. we as Gavi and the global health community faced resource constraints around malaria even prior to the current disruption. There are estimates that the global malaria control programs faced a gap of more than $4 billion each year in terms of being able to provide all the necessary interventions. And with the current disruptions around global funding, that those gaps have gotten even larger. From a Gavi perspective, we also have had to limit the scope of our malaria vaccine program to 85% of moderate and high transmission areas in order to ensure that we have the resources that we need to support our full portfolio of vaccines, not just the malaria vaccine. What this means is that this great challenge that we're facing is to ensure that we have sufficient resources from donors, from countries, in order to be able to meet the demand for those vaccines. And that's an area that we continue to work with ministers of health, with countries, and with other donors to make sure that we are generating the resources through our replenishment process to be able to continue providing the vaccines at scale for the coming 5 years. With that, I'll turn it back to you, John. Thanks.
Thank you very much, Scott. That's wonderful to hear. So now we turn to Professor Asante. Now, you've been closely involved in developing the malaria vaccine research agenda. I know you've been part of all these processes for all these years, for more than 25 years. And most recently, you and your team, together with WHO, Gavi, and other partners, have come up with some research agenda. Can you let us know what the key research priorities and challenges that has emerged, and particularly in terms of addressing knowledge gaps around vaccine performance, community acceptance, and implementation in diverse real settings? What are the key issues that are coming up, and where should we focus attention on the next research for the malaria vaccine?
Thank you very much, John, and good afternoon to all that are attending this session. You're right, it's been an exciting 20 plus years of working with colleagues and partners to investigate then the first malaria vaccine, and also to contribute to the development of other vaccines like R21 in various capacities. So it's an exciting time for me. I'll just go back a little bit into history, where we did all these phase 2 trials, phase 3 trials, and just when we thought, well, the data looked very good quality that had been collected in a place where maybe clinical trials were being strengthened, like Africa, and where the burden of malaria was also very high. Various partners reviewed the phase 3 trial data and thought that additional studies should be done. And for me, that was one of the challenges. So this large phase 3 trial has been conducted, and then there's some request to do additional data on effectiveness and further safety of the vaccine, and also to investigate the feasibility of implementing the vaccine in the current health system. And this took a bit of time. That's the challenge I bring about. And it's one of these challenges that we would like to avoid subsequently with next generation vaccines, in terms of leaving a gap and having time pass when a vaccine could be to be used. Having said that, there was quite scientific justification in that request for the pilot study, which is also a very large study. And so that provides, number one, lessons learned from this whole exercise. And so some of the things that we gathered for the malaria vaccine research agenda, which was conducted by colleagues from PATH and Clinical Health Research Center, and support from WHO and our technical advisory group. We basically did a lot of discussions among key stakeholders on the African continent and also across the world, identifying key research questions that are requested or needed for subsequent implementation. And this focused around the implementation of the vaccine itself, and also focused around the safety of the vaccine. And some of the things that we identified were, for instance, people were interested in, well, now that we have a 4-dose vaccine that has been approved for wider use, how is that going to be implemented in real life? Knowing that from the pilot study, dose 3 coverage was about 60%. And also knowing that other vaccine coverages like measles could be as high as 70% or 80%. How do we ramp up the coverage to get high coverages of the malaria vaccines? And what sort of capacity is required to ensure that the vaccine pharmacovigilance systems are also maintained? Because we recall that part of the reasons for doing the large phase 4 study or the large pilot studies was because of the safety of the vaccine, and people wanted to be assured that the vaccine was still safe. And in the pilot studies, we found out that yes, the vaccine still maintains its safety profile. But in terms of going forward, stakeholders are interested in ensuring that there are safety platforms that continuously identify any pharmacovigilance requirements. And then we are introducing vaccines into a system sometimes challenged by space, sometimes challenged by funding, just as was mentioned by Scott. So the question was, how do we ensure that the vaccines are stored appropriately and the vaccines do have enough capacity to be monitored so that it doesn't go bad? So the stakeholders were interested in that and ensuring that going forward, the capacity of the vaccine is really assessed. And so these were some of the things that came up from our stakeholder engagement and also from experts. And they are required to be looked into.
Thank you, Dr. Santi, for that wonderful information. It's quite refreshing to know that there's a lot of thoughtfulness, a lot of discussions that are going on which areas to prioritize that will become quite more responsive to the needs of countries. Now, Dr. Nebie, we know that Burkina Faso is not quite new to malaria vaccines. Actually, Burkina Faso was part of the countries that supported with the conduct of all the studies that were done. And Burkina Faso is also one of the few countries where both vaccines in terms of the RTSS and R21, the development and the clinical trials took place. But when it comes to the mainstream introduction into routine, Burkina just started about a year ago. But then we have seen that Burkina has made some significant strides to be able to ensure that the vaccine becomes available in a sustainable way. So as countries look to the future, what practical steps can be taken now to build more sustainable malaria vaccine programs, from strengthening health systems to mobilizing domestic resources and ensuring community engagement over the long term? How is Burkina doing it? And why is Burkina being pointed to as an example for how countries can begin to think about financing and strengthening the malaria vaccine and also ensuring that it becomes sustainable into the future? Thank you.
Thanks, John. And I'm really delighted to be part of this important conversation on malaria vaccine, and glad to support several countries within the African context to introduce this life-saving vaccine. As you mentioned, Burkina Faso has introduced the malaria vaccine in February 2024, and is about to switch to the R21 in the next quarter for 2025. This has been due to very great leadership at all levels in the country. And as you mentioned, I'm glad that you mentioned the community engagement as a key part for the success of malaria vaccine. And it's important. This importance is most of the time underappreciated, and reaching out early to respected influencers. I mean, here, religious leaders, traditional leaders, and also scientists who also contribute to this vaccine development. As you just mentioned, in Burkina, scientists have contributed substantially to the development of all these vaccines, and their contribution have been really appreciated. And that also makes a difference in terms of vaccine uptake when it comes to the rollout of vaccine in the communities. So And we need to continue community engagement before the launch of the vaccine. It's not just a one shot. So we need to continue conversation with the caregivers, and they have a hard job actually to make the tracking of the health appointment for all the children so that they can receive all the four doses on time. And also we have to combat the remorse, as we are in a situation where we can have a lot of hesitation and confusion around the vaccine. We need to find a way to listen to communities and respond quickly as possible to their needs. Healthcare workers, we can't not deny it, really the cornerstone for this channel in terms of helping caregivers understand and adhere to the vaccination schedule, and they have a really hard job. So we need to support them with trainings and update them regularly. And when healthcare workers are well trained, they can provide the right information to the communities, and that will all benefit to the immunization system, but broadly to all the health systems. So as part of PAF work, we are supporting a number of countries, and we help officials also who are keen now to down malaria vaccine, the malaria burden within the communities. And we do that through robust monitoring and evaluation of gaps and opportunities within the countries. We help for continuous improvement, and we also help train health workers in the communities so that caregivers can bring their children to receive the second, third, and fourth dose. And we are conducting also effective community engagement activities to reach caregivers so that they can bring their child back for all doses. So when it's come to malaria vaccine sustainability, country self-reliance and also political engagement and domestic fundraising can be seen as cornerstone for success. And this is also the dimension in which Burkina Faso is heading. Thanks, John.
Wow, thank you very much. And to our wonderful audience who are here, please be reminded that the Q&A sessions are opened. So please keep sharing your questions. We will be coming to you very soon so that you also have an opportunity so that we can take your questions to our wonderful panelists here. So please, we want to hear from you. Please keep on sending your questions. We will get time to be able to go through so that our panelists will respond to all your questions. Now back to Dr. Scott Gordon. Now that we know that momentum is building, you yourself indicated that there has been unprecedented demand for the vaccine. And now we have 20 countries and counting that have already introduced the vaccine. Dr. Asante talked about the fact that there is a new thinking to be able to look at what else do we know, what else do we do, how much knowledge again, or how much information do we continue to gather to be able to ensure that we push ahead with a vaccine for it to become much more available, much more equitable, and much more sustainable. Now, with all this momentum that is building behind next generation malaria vaccine, how is Gavi approaching long-term planning to ensure that future supply and demand are better aligned and that equity remains at the heart of access strategies? How is Gavi planning it, especially with the context of your 6.0 and all other future plans that Gavi has? What can you share with us?
Sure. Thanks, John. Well, it's important even to go back to our founding of Gavi. Gavi was established to ensure that low-income countries can access new vaccines and new technologies. So in that regards, then market shaping, working actively with manufacturers, with countries, with donors, is very much central to our role and always has been a core part of the organization. So I guess the three big ways that we are thinking about next generation vaccines, that we are working to align supply and demand, both for the existing portfolio of vaccines that we have, but also for future vaccines. The first off, we develop robust market shaping strategies and roadmaps. So Gavi works very hard to forecast the demand across all of the countries that we support and use those forecasts to support market shaping roadmaps for our partners and manufacturers to plan for future supply to meet the demand that we're anticipating across the 57 countries that we are currently supporting. For future and next generation vaccines, we also work with our partners to look at the emerging evidence, to look at the questions that are being asked, such as what Professor Asante was alluding to, and And we look at as well as the potential impact of vaccines, next generation vaccines, vaccines that are currently in the process of being developed. And we put together forward-looking vaccine investment strategies. These are multi-stakeholder, multi-stage processes, really looking at the current evidence around the vaccine, as well as the potential demand for the vaccine and the potential impact of the vaccine. And we go through a robust external process of validating those investment strategies that we then take before our board, even prior to the availability of the vaccine, to get the board to commit to that strategy moving forward. Now, including the vaccines in both our current market-shaping roadmaps and these types of forward-looking investment strategies, what that does is it provides manufacturers with stability regarding potential markets for the new products. We also work with our market shaping team and our forecasting to go through pooled procurement processes in order to be able to both negotiate the best prices for the vaccines and making sure that we are able to afford supporting the prices, the vaccines for the countries that we are supporting, but also it helps to provide a stable market for the manufacturers. And these are all really particularly important elements of the market shaping strategy that we have for vaccines that are targeting diseases of poverty, such as malaria, as well as markets where vaccines where there's not a dual market, where we can't expect countries such as those in Europe or in North America to have a large market for the vaccines to offset the costs for lower income countries. A second major strategy that Gavi is using is that we're able to bring to bear novel financing tools to help facilitate access to these new technologies. So in the case of the RTSS malaria vaccine, we worked with GSK and MedAccess to help de-risk the actual production of the vaccine at a critical transition point between when GSK needed to be scaling up the production of the vaccine, but yet there was not an official recommendation by WHO. So helping to step in, working with other donors, other suppliers to be able to de-risk that development was a really important piece and an important step in making sure that RTSS could be brought to bear very quickly. And we know that sharing risk is a critical tool for accelerating the development of vaccines. Gavi also has a special initiative known as the African Vaccine Manufacturing Accelerator, or AVMA. That's a special initiative that we have that provides financial and market incentive mechanisms for the development and the productions of vaccines in Africa for Africa. And malaria vaccines are among the target vaccines for AVMA. Finally, another key aspect of the work that we do and the way that we are supporting the access to the vaccines, the stability of the vaccines, is really through our long-term support that we provide to countries for their immunization programs and to suppliers in looking at the markets for the vaccines moving forward. Our vaccine support grants to countries are ongoing. It's not just a fixed period of time and saying we will support a country for the next 3 years. It's an ongoing support. And so that stable support helps countries to plan for their immunization programs moving forward. But our support model also has sustainability built into it. So countries, as Dr. Nebie mentioned, countries share in the purchase of the vaccines. They contribute to that. They make their own financial commitments to the procurement of the vaccines. That again helps to stabilize their own commitments moving forward. But our co-financing model that we have around that purchase also addresses the ability of countries to continue developing economically through a graduated model and not lose the support from Gavi. So we factor that in moving forward. So ultimately, this long-term support is really geared to provide stability to countries for the planning, the provision of the vaccines, but also providing stability for manufacturers around the markets of the products. Ultimately, our goal is to continue to support and help to build a robust market of suppliers and to help support the use of new and emerging vaccines. And so we're really excited to see clinical trials underway for new vaccines, as well as some of the announcements that we're seeing right now about vaccines that are actually targeting multiple life stages in the malaria life cycle. So it's really exciting to see these new things, and that's part of what our market shaping strategies and our vaccine investment strategies are really trying to gear is supporting that long-term support for vaccines like malaria. Thanks.
Yeah. Thank you very much, Gavi, for that forward-looking and that proactive steps that are being taken to be able to ensure that the vaccine not only becomes sustainable, but then access is also optimized. Now, Dr. Asante, now that you've been part of the whole process with the first generation, and now we are transitioning to the second generation vaccines. What areas of research do you believe will be most critical to inform this next phase of malaria vaccine development and deployment? Is it whether in optimizing the use of the current vaccines or preparing for the next generation of malaria vaccine products? What should we be doing? What should we be expecting? And how can the global system help you as scientists and researchers to be able to move towards this objective and aim quite quickly? Thank you.
Well, thank you very much. And I think ultimately we are looking for a safe vaccine, an efficacious vaccine, an impactful vaccine. One that is fit for purpose, and what I mean by that is one that can easily be implemented and delivered to the children that need them the most. And also one that can quickly be developed without long timelines whilst children are passing on. And then one that is affordable. We heard from Dr. Scott Gordon about countries contributing to the purchase of vaccines. And therefore, it's important to ensure that these vaccines are affordable for the pockets of many places where, unfortunately, the economic burden also overlaps the burden of malaria. And so with that in mind, and also with the experience of the development of the previous vaccines, I think the key thing to achieve a vaccine that fits this purpose is collaboration. In developing the RTS malaria vaccine, and I think to a large extent the R21, collaboration among partners was key. And so I think that is an overarching goal to ensure that we develop and deploy a new vaccine. With regards to whether we want to optimize the existing ones and or develop new ones as next generation, I would say that these are two critical pathways that we need to follow. We need to ensure that the current ones are optimally used, whilst we ensure that we hasten to develop new ones. What do I mean by optimizing the use of these current ones? One is ensuring that if we have a vaccine that is probably half the dose of the current ones and still efficacious, still safe, and still impactful, probably that's the way to go, and make sure that we get that new vaccine on the table. The other one I would say is vaccines, current vaccines that can be optimized for other populations, like adults, because we note that to drill down the burden of malaria is got to cover other populations and ensure that they are also protected. New vaccines that could also target pregnant women is also required. And also these vaccines that currently do exist should work in different transmission areas. We've heard and seen data from the use of the malaria vaccines in areas where malaria is seasonal, like Burkina Faso, where Dr. Nebie works. Other vaccines should also be tested in these areas to ensure that they can be used in different malaria transmission settings. Also, the design of assessing the impact of malaria vaccines could also be looked at because it enhances the timely delivery of vaccines. So we spent a long time doing the pilot study, large study, but there could be other approaches like case control studies that could be used to assess the safety and the effectiveness and impact of the malaria vaccines. We spoke about equitable delivery of vaccine, and therefore we think that if there is any way of addressing the equitable delivery of vaccines, either by reducing the number of doses such that a child that is only seen at a health facility once in 5 years could benefit from that vaccine and could be protected from that vaccine. We've learned from COVID in the last few years that we need to have a variety of delivery panels for vaccines and also production from different places, such that if there is a shortage by one production company, we could have it from others. And so I would say that, yes, we still need to collaborate with people, collaborate with scientists, collaborate with implementers and partners to ensure that there is a good large market for vaccines, such that children are continuously protected with vaccines whilst they continue to use their existing bed nets and other interventions that are available. The last I'll talk about is with regards to optimizing the vaccines going forward, is how to deliver the existing vaccines with other interventions like chemo prevention, and whether it's important to combine them and how to deliver them and at which time points is crucial. And these are some of the things that we can be thinking about when thinking about optimizing the current vaccines and or developing new second generation vaccines.
Great,
Thank
Dr. Asante, thanks you for that perspective and pointing us to the areas where you as researchers and scientists think the focus for the next generation of vaccines should be looking at. But then in doing so, Dr. Nebie, I want to come back to you because at the end of the day, it's all about countries being able to uptake all the vaccines and ensuring a sustainable use. Now, you've talked about the efforts that Burkina Faso has already begun. But from your perspective, what have been the key enablers of sustainability planning and strong government commitment in Burkina Faso? And what challenges has the country had to navigate along the way that may offer important lessons for other countries? Dr. Nebie.
So thanks, John, and that's a very good one. So it's been really impressive to see how the Ministry of Health and the key stakeholders are prioritized delivering the malaria vaccine to where it's most needed in Burkina Faso, and that was done as rapidly as possible because the country was the second one to introduce the malaria vaccine in the West Africa, actually. So when we introduced the vaccine in February 2024, we now plan to have the scale up with R21 in the last quarter, in the next quarter of the year. And one of the conditions for that product switch was that the country should be able to self-finance at least 15% of the country needs for malaria vaccine, in addition to the co-financed doses. So, and the country was able to fulfill this commitment by self-procuring these 15% of doses. And thanks to the country parliament that allowed a special allocation of 5 billion for malaria control intervention, including malaria vaccine. And to say that all that takes a strong leadership, consistency, and commitment at all levels within the country. So this leadership has been translated into at the Ministry of Health into a very good collaboration and cooperation between the National Immunization Program of National Program of Immunization and the National Malaria Control Program, where we have seen very good collaboration. And this was one of the challenges that we faced with malaria vaccine deployment in several countries since the start of this deployment. And we saw similar political will and leadership when the country also successfully deployed the typhoid conjugate campaign in January with very high coverages. That all said, Burkina Faso leaders recognize that investing in immunization and prevention is cost effective, and this is also a good investment for prosperity, actually. it's really worth noticing that we won't say it enough that the country researchers have really contributed to malaria vaccine development, and this built trust to both products in the country. When it comes to challenges, one of the challenges that we see here is how do we manage for all the children to come back and receive all the 4 doses? We have seen huge dropout rates from those 1 to those 3, and the same is also true for those 1 to those 4 in the country. And how do we manage to strengthen these dropout rates within the country? And another challenge, lastly, will be how do we make sure that malaria vaccine is delivered alongside with other malaria control interventions? And the vaccine should be seen as an additional tool and not a replacement of other malaria control interventions. So it should be an integrated approach to defeat malaria. Thanks.
Thank you very much, Dr. Nebie. Now is the time for us to come to you, all our important guests, people who have joined from all walks of life. This is the time to respond to some of your questions. Please keep them coming. We'll be addressing some of the questions that have come through so far. As we said, for some, maybe because of time, we might not be able to answer all your questions, but we'll continue to provide you responses. All these questions will be available to the panelists and they can continue to address them. But please keep them coming, so that the time that we have now, we can discuss your questions, your contributions, and then your concerns. Now, Professor Asante, I'll address this question to you. One participant says that as we work to comprehend the vaccine's impact, which would require some time, what differences might we observe between its real-world effectiveness and the clinical efficacy seen in trials? Additionally, would these variations differ significantly between the RTS and the R21 vaccines? So can you share a bit more about some of the results from the malaria vaccine implementation in terms of the pilot implementation where these were introduced in real-world settings? And would these results differ between RTSS and R21? How can we begin to comprehend what the real-world impact of the vaccine would look like, even as we wait to get more data from countries to be able to confirm all these things throughout? Thank you, Dr. Santi.
Thank you very much, and thanks to the questioner for bringing this up. And it's a real important question that we hear all the time. The exciting news is that after the phase 3 trials, where the efficacy was found to be good, vaccines had a good safety profile, it was important to look at the impact in real life. And so we embarked on the malaria vaccine pilot evaluation, which was led by WHO and conducted in Ghana, Kenya, and Malawi. And the vaccine was introduced in a phased process, in that some communities did have the vaccine and others did not. And that helped us to evaluate the impact of the vaccine. After 2 years of introduction of the vaccine, we realized quite exciting news around impact. And for instance, we saw that there was about a 32% reduction in hospital admissions from malaria just after 2 years of introducing the vaccine. And if you look at the burden of malaria in hospitals, malaria is a leading cause in hospitals. So that was found. And then there was also a trend towards about a 9% reduction in all-cause mortality, excluding injuries. So these are very exciting results that we found after 2 years of the introduction. We're still discussing the data after 4 years, and that's going to be published very soon. And also shows very interesting trends and very positive trends. We note that the effectiveness that we are seeing sort of mirrors the efficacy that we saw in the phase 3 trials. And as you say, it's likely that moving forward, we'll be able to assess the impact over a longer period. But for now, it's very exciting to see the trends towards mortality impact and then also reductions in hospital admissions for malaria.
Thank you, but can you address whether there will be variations between RTSS and R21? Do you anticipate any variations? What do you know now, and what do you foresee could be happening in future?
Well, I do not envisage variations. I don't know what it would be. I know that there are studies that are currently ongoing to look at the impact of the vaccine, and so that is yet to come.
Okay, thank you very much. Now, Dr. Scott Gordon, I come to you. Now that Gavi is looking at optimizing the vaccine, the supply, the funding, and making sure it becomes equitable and available to all children everywhere, a question I want to know, the role that alternative delivery technologies such as solid dose vaccines or microneedle patches play in extending the reach of the malaria vaccine to every child everywhere. Thank you.
Thanks, John. And it's nice to hear somebody who's really thinking together with Professor Asante really forward in terms of how can we advance the new technologies around providing malaria vaccines. To date, we do not have new delivery technologies for malaria vaccines in terms of the actual delivery of the vaccine. We are seeing a number of new strategies that are being employed in countries for expanding the reach of the vaccine, and as Dr. Nebie mentioned, combining the vaccine with other interventions. So we have Mali, for example, that just last month rolled out the vaccine using what's known as a hybrid delivery schedule, which means that they are providing the first 3 doses of the vaccine based upon the age of the child, and then they will be scheduling the 4th dose just prior to the high transmission season there to really maximize the impact of that vaccine as children move into the high transmission season during the following year. That's an exciting opportunity to really maximize the match between the vaccine's efficacy profile and the transmission of malaria. That's an exciting technology. We're seeing other countries that are looking at trying to build upon seasonal malaria chemoprevention schedules for checking the vaccination status of children, combining some of the communication around either SMC or perennial malaria chemoprevention together with the malaria vaccine, so combining it with other chemoprevention strategies. We're seeing that is taking place in countries, and we're very supportive of that. We're seeing other new exciting little technologies, such as the use of drones to deliver vaccines to the last mile in Ghana and Nigeria as well. So all of those are sort of intermediate steps that countries are taking in terms of working with the current vaccine administration strategies to try and reach more and more kids. As we have more technological developments in terms of new ways of administering the vaccines, we of course will be looking at those and looking to see how we can incorporate those into our support moving forward.
Okay, thank you very much for that. So for Dr. Nebie, I come to you. Now, we know that different countries have got different prevalence rates for the malaria vaccine, and even different parts of the country have got different forms of prevalence. Some of you get to some countries that you have low, high, and moderate settings across the country. So a participant wants to know, with all these things, how are the stakeholders and staff taking efforts to be able to ensure that they allocate the vaccines and the resources accordingly in terms of the different prevalence patterns in the countries? How do you prioritize which areas should get a vaccine and which areas shouldn't receive the vaccine, and how is implementation going on? And are there issues and concerns that are coming up for areas that are currently receiving the vaccine and others that are not getting it? Dr. Nebie, with your experience working across countries.
Yeah, thanks, John. That's thanks to the questioner for that great question, and it's really a big challenge when you have a country where you have a low transmission, moderate and high transmission within the same country, and it be very difficult to explain why we are not going to some of the settings within the country. So one of the means that we use to address that, currently we know that the vaccine is supported for moderate and high transmission settings. So we when we were introducing the vaccine initially, we based that on subnational tailoring for malaria burden, and also this include incidence of malaria and under 5 years mortality. Based on that, we allocated the vaccine to the places where we are in most needs. And that was the basics of rolling out the vaccine as a stage rollout in the countries where we already have the vaccine introduced. And we are now going to have the scale up following the same pattern. But since we have now enough supply within at global level, we are now able to scale up easily in all the settings. But it's quite, we need to communicate clearly with our communities. And for sure, all the countries, all the communities want to get the vaccine, and this needs to be addressed carefully so that we are equitable in vaccine distribution within our settings. Over.
Thank you very much. And back to Dr. Scott Gordon. We know that children get the most impact or the most value from the vaccine if they're able to take all 4 doses. So what dropout rates are we seeing with the new countries that are joining on board, whether with RTSS or R21? And how consistent is this with the early pilot implementation data that we recorded from Ghana, Kenya, and Malawi? And if these countries are having huge dropout rates, what steps are being taken to be able to lessen these rates? Thank you.
Great. And thank you to the questioner. And that's a question that we get asked a lot. And it's something that we continue to work with all of our partners to try and address. In terms of the 4th dose, just to address that first, given the schedule of the vaccine and the provision of the vaccine during the 2nd year of life, countries are just now starting to roll out the 4th dose. Those countries that introduced the vaccine in 2024, with a few exceptions, are really now just starting to roll out the vaccine. So although we're starting to get some initial coverage evidence on dose 4, it's still very preliminary, and so we don't really have a clear picture of that yet. Dose 3 is lower than we would like in many countries. In many countries, the coverage rates with dose 3 would range from 30 to 50%, and the dose 3 coverage will largely vary depending on how advanced the immunization program is in reaching out to the communities, engaging the communities, as well as the healthcare workers around the uptake of that 3rd dose. It is something that we continue to work with all of our partners, our extended partners, including many who are represented on this call, as well as our core partners, to work with countries around strategies to increase awareness and uptake of the vaccine. That could be increased community engagement activities, trying to really build demand at the community level. That could be specific strategies that we work with in countries, such as the periodic intensification of routine immunization, and trying to get countries to strengthen the mapping and the outreach for not only the malaria vaccine, but for other vaccines. It also includes many of the other technical assistance strategies that we have, working with the immunization programs themselves to make sure that the healthcare workers are able to communicate the schedule and advise parents on when they should be coming in for the vaccine. So I would say on the whole, dose 3 coverage is increasing, and that's really what we're looking for at this point in time. But it's not at the level that we'd like to see. Reflecting on the impact of the vaccine, though, what we saw in the 3 pilot countries is that we can have a significant impact from the vaccines, even with less than ideal coverage of the 4th dose. So the evaluation that was done in the 3 countries found that we could still see a 13% reduction in all-cause age-eligible mortality when we exclude injuries, as Professor Asante mentioned, even with coverage of the 4th dose that was in the 30 to 40% range. So we know that there's significant impact even after 3 doses. And as we continue to increase the coverage rates for both the 3rd dose and the 4th dose, we know we'll see even more impact. Thanks.
Thank you very much. So because of time, this probably might be our last question, but I think it's quite important and quite critical. So Dr. Asante, now with all the challenges with keeping the 4th dose vaccine and all that, would we ever get to a time where we probably would be looking at using fewer doses and still have the same efficacy and impact?
Well, I think that's an aspiration. I think it's important that scientists and partners continue to work on vaccines to make them very innovative, to make them accessible, and to reduce the number of times children go to the health facility to get a vaccine. That's the ultimate goal of ensuring that we have a vaccine that would enhance uptake and then would ensure that there is protection and it's impactful. So I think that, yes, scientists will probably work towards that and make sure it's available, but we take the steps at a time. What we know now is that for these current vaccines, at least we should be taking 4 doses of the vaccine, and is likely to ensure that there is a reduction in all-cause mortality of about 9% after 2 years of introduction, and the trend shows about 13% after 4 years of introduction. And that's the exciting bit. And I think that there's more room for innovations to happen.
Sure. Thank you very much. With all these good projections and expectations, we think that the future is very bright. And in fact, as we wrap up, I want to take a moment to extend our sincere thanks to GSK Global Health for their support in making today's discussion possible. Their commitment to advancing global health and supporting innovative solutions in malaria prevention is truly appreciated. We are grateful for their partnership in helping us facilitate this important conversation and in supporting this ongoing webinar series. In fact, you, the audience, the panelists, and everybody have been our wonderful anchor. We really have enjoyed working with you this time, and there are more series that will be coming, and we hope that we will be able to get an opportunity to be able to meet up with you. For those of you whose questions we couldn't address, please be assured that we will send all these responses to you. And also, we will also be sharing the contacts so that you can do follow-up and then share additional information. I know one question I was asking about DRC, and it's important for me to add that DRC is one of the countries that have already introduced the vaccine. They started with 1 province, and this month they are expanding to additional 8 provinces. They just started with an additional 1 last week, and others are coming on board. So DRC has joined the bandwagon. So please, wherever you are, they need you on board to be able to support all these processes. You've been all wonderful. We thank you all for your time, and we love you, and we enjoy your participation. It's been great. We've had over 400 people joining this webinar, and this wouldn't have been successful without you. Thank you for your time. Thank you for your attention. Thank you for your availability. For our wonderful panelists, thank you for all the time. Thank you for the knowledge that you shared with us. We hope to be able to come back to you again in future. It's been great working with all of you. Thank you.